Today I have the great pleasure of interviewing our President, Professor David A Scott. So to start, as a trainee and an almost new fellow, where do you see the college going in the next 5 to 10 years?
Hi Shanthi. I think the college has got a lot of challenges ahead of itself over the next 5 to 10 years. For a new fellow, you're going to be practicing in an environment where there's going to be more emphasis on revalidation and CPD. I think the college has positioned us well from a CPD point of view. And that's fortunate, and you'll be participating in that. There's changes to the practice environment. We're looking to progress perioperative medicine, as I'm sure you're aware. We're all perioperative medicine experts, but some people want to actually develop specific expertise in that. So you'll have the opportunity over the next 5 years to be able to enhance your skills in perioperative medicine. Whilst all your colleagues, if they don't want to do anything extra, they've got the basic skills and just maintain their education with that. I think the college is going to provide more online educational content. We're going to be reaching out more to people to enable them to, wherever they are, gain updated skills, updated knowledge in things that matter to them. Finally, I think there's going to be potentially a challenge with GP anaesthesia. So rural GP anaesthesia, we want to see that we as the College of Anaesthetists are managing that, oversighting that, so that all anaesthesia in Australia is provided by doctors, suitably trained medical practitioners, and wherever possible that's provided by specialist anaesthetists such as yourself.
So one issue that has obviously been very topical recently, and I know that you've been very involved in, is the issue of bullying, discrimination and sexual harassment. I know that you've assessed the extent of the issue with the working group, but what do you see as the next step in terms of addressing the issue?
That's a very good question. So I think the next step is to follow the action items that the BDSH working group has identified, which we are doing now. We've probably already started to substantially meet some of those actions, the first 3 or 4. And what those actions mean is that we want to create a safe working place. It's really, really stressful doing the sort of critical care practice that we do. There's all sorts of everyday stresses we face in the care for our patients. So one aspect of that is enhancing our resilience in handling those necessary stresses that we face. And so we don't need, on top of that, bullying, discrimination or sexual harassment making people's lives stressful or miserable. And so we're working with other colleges, the College of Surgeons in particular. We're working with other healthcare networks to try and make sure that there's a safe workplace. So we're trying to protect the practitioner in their environment so they can contact the college if they need support. We're going to respond to any raising of concerns, and underpinning all of that, we're preventing it, we hope, by appropriate training in professionalism and the understanding of the expectations. So prevent, protect and respond is our way of dealing with this.
So looking broader now, what do you see as the role of the college in improving anaesthesia practice overseas, so for example in developing countries?
College has a responsibility, I think, to do what we can to help particularly our neighbours in underdeveloped local countries like in the Asia Pacific region, and work with other organisations such as the ASA as well and the ANZCA to have a coherent response to providing either assistance or education. And we see our biggest strength is in providing education. We have a large outreach in Papua New Guinea, and we're supporting that even more. And we can broaden that as well. We provided a scholarship to Rwanda last year, and to have those practitioners come and participate here. If we can help set standards in those developing countries, educational standards, practice standards, I think that will be a great contribution. And then there's other programs, of course, like Lifebox, where we can actually help with the infrastructure as well.
In terms of the proposed change from anaesthetist to anesthesiologist, what's your stance on that?
Well, I would say it's a proposed discussion point at this stage. Look, there's a lot of shift around the world in the non-anesthesiology areas to anesthesiologists. So potentially the AAGBI, potentially the UK, probably they'll be one of the last to consider changing. But from our point of view, if our membership wants to change, I can see advantages to it. Anesthesiology is easier to say. It reflects professionalism and it reflects research as a basis, and the difference between people who just provide a service, and professionals like us, is that we do research to continually improve our practice. So anesthesiology might reflect that in a name, and if the membership is keen, if our sister organisations are supportive of a combined approach to this, so we do it together, then I think it's a possibility, but we are opening the discussion for that at the moment.
Interesting point.
Yep.
You're not going to say it anesthesiology?
No, it's going to have an AE.
Oh, okay.
Yeah.
Okay. So
If it happens, it will be an AE.
Okay.
Yeah.
All right. So we heard today that anaesthetists are a fraudulent bunch of professionals. Do you think that's in our nature? Are we a dodgy bunch of people?
What we heard today was that in scientific publications, there's a percentage of 1 to 2% which might have data in them which might not represent honest research practice. But that is across the board. It's not just anaesthesia, it's across the board. What anaesthesia is doing is leading the way in looking at that and self-reflection, examining that, so that our standards are the highest in the world.
Oh, that's good. You brought it back to something positive. Well done. So for all of us who don't know, you're obviously David A Scott. What does the A stand for, and does that make you better than ASA President David M Scott?
So to answer the easy question, the A stands for Anderson, which is my mother's maiden name.
Oh.
And that certainly doesn't make me better than the other David Scott. David M Scott and I work quite closely together, and I think we've forged a good relationship between the ASA and ANZCA, and we'll continue to do so.
Well, I'd like to thank Professor Scott for his time. I don't know what else to say.